Fortunately, new drugs have been coming. So this, in the last decade, we have this glucagon-like peptide 1 receptor agonist, as well as the sodium glucose link transporter 2 inhibitors. So let me give you a little bit of the background. So for the glucagon-like peptide, in fact, this is a glucoregulatory hormone. So it's released after food intake. So it's a little bit like a counteracts the actions of insulin. So the glucagon-like peptide 1 receptor agonist can promote satiety and reduce appetite, and it's also reduce hepatic glucose production, slow down the gastric emptying, and also increase glucose-dependent insulin secretion. So how about the sodium glucose link transporter 2 inhibitor? So the sodium glucose link transporter is a co-transporter, and the SGLT2 principally is the principal co-transporter in the kidneys, especially the proximal tubules. So it can actually resorb the sodium and also glucose from the filtrate back to the blood. So by the sodium glucose link transporter inhibitors inhibits the action. So as a result, it can increase the secretion of glucose and sodium to the urine. This is a summary of the cardiovascular benefits of these drugs. So you can see that both GLP-1 receptor agonist and SGLT2 inhibitor has been shown to reduce cardiovascular mortality compared with the neutral drugs DPP-4 inhibitors. So how about the heart failure events? So far, we don't have any hypoglycemic agents that can reduce heart failure event until the discovery of the GLP-1 receptor agonist as well as the SGLT2 inhibitors. And you can see that both drugs actually reduce heart failure hospitalization. So let's look at individual trials. So for the GLP-1 receptor agonist, yes, they may reduce cardiovascular events. So from individual trials, we can observe a reduction in MACE rate. But if you put them together, the reduction in MACE rate appears to be mainly driven by a reduction in cardiovascular death as well as the non-fatal myocardial infarction. However, for hospitalization for heart failure, each individual trials, the results is a little bit borderline. So how about the SGLT2 inhibitors in type 2 diabetes? So this is the results of the EMPERAC trials as the CANFIRST trial. So I would say that this group of drugs are the first drugs that has been shown to have a definite benefit in terms of heart failure hospitalization. So for the EMPERAC study, it can reduce the empagliflozin can reduce cardiovascular events by 14%, reduce cardiovascular death by 38%, and reduce all-cause mortality by 32%. For the canagliflozin, it has been shown to reduce the 3-point MACE by 14%, although it has not been shown to reduce cardiovascular or all-cause mortality. So how about heart failure? For both studies, heart failure are not the preset endpoint, so this is like an exploratory endpoint. However, in both the EMPERAC study and the CANFIRST studies, the SGLT2 inhibitors has been shown to reduce new heart failure development compared with the use of placebo.